Your relationship with your body is the most important relationship you're going to have. And there is a test for breast cancer that is extremely important and one that you might not know about. Dr. Sherry Tenpenny is the person we're going to talk to find out about this test. So what is this test?
The test is called, a lot of people know it as thermography, but we refer to it specifically as infrared breast imaging because that's what it is.
And how is that different than the mammogram?
A mammogram is an x-ray of your breast that looks at the anatomy of the breast. This scan looks at the physiological changes that are happening in your breast. So we can detect abnormality anywhere from 3 to 10 years before it will show up on a mammogram.
That's crazy.
There's no pain, no radiation, no compression.
You're not going...
That's right.
Okay.
And we can start screening people in their 30s to identify increased risks of cancer.
Oh my gosh. And so why is it people don't know about this?
I'm not sure why they don't know about it because this has been an FDA approved test since the 1980s.
Okay.
It's painless. Some insurances do pay for it. They pay for the office visits, and it's a way to get ahead of the game because you can intercede with diet, lifestyle, exercises, and supplements to decrease your risk of breast cancer.
And so now if I'm doing this because I want to be proactive, right?
Exactly.
Do I need to like worry that, I mean, is there something that's going to show up that says, well, maybe you might get breast cancer, or?
No, it's sort of like if you go to the doctor and you get a cholesterol test and you find out that it's 400, and everyone knows that cholesterol over 200 is high.
Right.
So if you get an abnormally high test, you say, I need to be proactive to lower my risks. And so there are certainly things that you can do to lower your risk, and it certainly does not identify cancer. What it does is identify a risk factor that may develop to cancer if you don't take action.
I see. So then you change your lifestyle.
Lifestyle, supplements that have been shown in the medical literature to decrease the risk, iodine, turmeric, calcium D-glucarate, all of those are wonderful.
This is amazing.
Thank you.
Now, do you know people who maybe had a mammogram and they missed something and then they had a thermogram and they caught it?
Absolutely. We have many patients in our office, we've been doing this for about 8 years, that they had a normal mammogram, the thermogram came back positive, the patient went back and insisted on further diagnostics, and they found a cancer that was there. So that thermogram actually saved their lives.
Oh my gosh. You know, this is such a radical idea. We just aren't used to it, so we need to keep talking about this.
Great.
And now, don't you have this wonderful center that's brand new, and don't you devote some of it to just breast thermography and breast health?
We do. We have an entire area in our clinic in Middleburg Heights that uses the infrared scanning. We have another test called a Halo that can start testing women at age 25 for increased risk of ductal problems in their breasts. We have a supplement center. We have a very unique breast exam that can take up to 20 minutes to get your breast fully examined.
Okay.
And so we have a whole area that is just dedicated to breast health and to hopefully over time lower the risk of people getting breast cancer in the future.
That is fabulous. And when you say a breast exam, I mean, are we talking like a minute, or I mean, how long are you working
I think that most women understand that when they go and get their annual Pap exam, their breast exam is it's almost like the doctor doesn't want to touch you.
Exactly.
Exactly.
Yeah.
This is a very thorough exam. It's done on 3 different levels: superficial, intermediate, and deep, and it can take up to 15 or 20 minutes for trained, educated fingers to find. It was based off of the principle that if you can learn to read Braille with your fingers, you should be able to find abnormalities at a much earlier stage.
You must feel good because you're really doing a lot of good work.
We do. We do great things for women. I'm always proud to say our clinic has had patients from 38 states and 11 foreign countries to come through our programs and get better and well.
Thank you for the work that you do.
Oh, thank you, Kat.
If you want to get a hold of Sherry, you can give her a call at 440-239-3438 or go on to Dr. Sherry Tenpenny's website at tenpennyimc.com. Stay tuned because we're going to be back with Rate Your Relationship.